And I'll now introduce Maria Garrett from Gippsland PHN to speak on improving barriers to health service access for older people. And in the interest of transparency, I'll just disclose that the agency I work with, Health Issues Centre, was the research agency involved in this piece of research.
Hello everyone. Yes, that's right. So I work for Gippsland Primary Health Network, but the actual research was done through the Health Issues Centre, as Danny has just described. First, about Gippsland Primary Health Network. We're a federally funded organisation, one of 31 across Australia. Our aims are to improve the health of people in Gippsland through directing investment to address our unique health needs. And for us, that means a bit over 270,000 people. We're a rural regional area with some remote parts. If you don't know where you are, Melbourne's here. This is Gippsland, and if you travel from Malakuta in the east to Melbourne, that takes you about 6 hours. We have significant areas of very high disadvantage, and our population is older than the average for Victoria. 22% of our population are aged 65 or older. So background to the study, as I mentioned, we try to direct our investments to address the needs of our population, so that means we need to know what those needs are. So in 2018, this project came about through a desire to improve our understanding of older people and what their barriers are to accessing health and social services. And we wanted to use a community, consumer and carer-focused approach, and that's why we approached the Health Issues Centre to engage with people aged over 65, but also focusing on those with declining capacity and dependency. So the methods we used were based on the social listening methodology that has been developed by the Health Issues Centre, and that started off with the Facebook page, which was titled The Challenges and Opportunities of Ageing. From there were links to 2 online surveys, one for older people themselves and one for adult children who had older parents. There was, being a multi-methods type study, there was also a component with intercept conversations or face-to-face interviews with older people. And there was also phone interviews with social care and community professionals to add that aspect to the mix. The questions that were asked included very broad questions to understand the older person's priorities from their perspective. So there were questions like, what concerns you most about ageing? What barriers do you have for accessing healthcare? And what would make your life better? So taking a very broad approach. This slide shows the age of respondents for the different methods. So what I'd like, So what I'd like you to notice on this one is for the online surveys for older people, that 73% were aged 65 to 74, whilst for adult children who responded to the online survey, 60% of the parents there were aged 85 or older. So there was a bit of a difference in the age of the person in question between methods. Next, moving on to results, what was found to be the most challenging things about getting older? And this slide shows responses by older people in the red or orange, and in blue the adult children's perspective. So there were some set options provided and room to add their own. So as you will notice, the older people were most likely to choose not being able to do simple things as the main challenge, whilst for adult children with ageing parents, the top response was looking after themselves or their spouse. The interesting part too, though, are the free text responses where some themes were identified. They included loss of capacity or physical limitations, being patronised or ignored, looking after ageing relatives, and emotional impacts of seeing their friends dying. Next question looks at the main concerns about ageing, and again looking at older people's responses compared to adult children's perspective. And here the top response by older people was losing independence, followed by losing physical and mental capacity. Whilst the pattern for adult children is quite different, they picked pain and suffering as the main concern, but also a recognition of losing physical and mental capacity as an important factor. So what did they see as being able to make the older person's life better? Here, the older person's top response is money, whilst for adult children, it's actually something quite different, better healthcare. So why might that be? And I need to remind you again here that the age group for the people in question here is different, so it could be that there's less difference than what these results may indicate, but still it's interesting to look at, isn't it? So I'd now like to move on to looking at the key findings across the different methods that were used for the study. First one is loss of capacity and incremental decline, and this refers to decreased ability to accomplish day-to-day things, which then easily can impact on a person's identity and emotional well-being. And the identity referring to being put into a box as an elderly person, and then that can mean a lot of things. Some quotes might illustrate. One person said, "I can no longer take a holiday or go and visit my family. I can't even see a movie anymore." And another, "I want to be recognised as an individual with skills and experience that I can contribute to the life of my community." Going on with some other key themes, empathy and validation were something that really stood out as something that was crucial. There were personal experiences of people being invalidated, patronised, belittled, and treated as an unreliable witness to what they were experiencing. This relates to communication of clinical information, or when older people see a health professional. There was a fear of reduced independence and, for example, a fear of relocation to a residential aged care facility against their will. Again, we move on to some quotes. An older person said, "Not being listened to and being dismissed as being irrelevant." A professional said, "A lot of people are not aware of services until it's too late," and that relates to the communication of clinical information. It's, counterintuitive, but we'll get back to that. Last slide with key findings. Gender came up as a theme, which relates to older women often being responsible for accessing care for their husbands. Access logistics, these things won't come as a surprise to many of you, I'm sure. Cost of services and travel and distance and transport are huge issues in a rural regional area that affect so many people. Waiting times are another factor that keeps coming up, and factors related to clinical care or the issues of coordinating the care that's right for that person. And finally, carer support is a massive issue. An older person said, "I have a taxi card, but I can't use it very often as I can't afford the amount I have to pay. How I'd love to be able to visit a friend now and again." We've got endless websites and brochures, but it's not helping people. And I waited over 12 months for a carer's pension, and that person also said that it had had a huge impact on that person's relationship with their partner and the family life. This spiral of decline and withdrawal is, I guess, a bit of a summary. It's a model that the Health Issues Centre developed based on the findings from this study and, I'm guessing, broader knowledge. You will recognise some of the key themes here. If we look at the starting point as up here with loss of capacity, that often goes on to lead to a loss of identity, a lack of validation and empathy. If that happens in the clinical setting, you're at risk of social and clinical withdrawal, which leads or can lead to isolation and depression, which leaves the person vulnerable to a health crisis, which is likely to be not handled as well as it could be by the health system, and if there's been a period of withdrawal, and that can then lead to further loss of capacity, and you're going down the spiral of decline. Illustrated by this quote, "Dad refuses help." That's got an element of having withdrawn, but it can also be the denial of that lack of capacity, which is quite common when people get older. However, we must move on to opportunities for intervention instead of focusing on the spiral of decline. So I'd like to focus some recommendations on where we might intercept this spiral of decline and withdrawal instead, and what we can do to slow that down or stop it from happening. Firstly, clinical empathy and communication are key. Empathy by clinicians is so important, as are effective communication skills, which should be taught throughout clinical education and throughout the working life. Clinical engagement and monitoring, having enough time in face-to-face consultations is crucial, and a role of systems navigator for personalised care can be very helpful to help find the right services for that person. When it comes to access logistics, a minimally disruptive medicine approach where the plan is developed with consumer at the centre to understand what they want and need, and providing low-cost transport and accommodation close to services can make a big difference. And finally, offering carer support, and that can be as simple as promoting existing services and support groups, which are often not well known. It was said in the report that the most important feature of a good doctor is one who listens and hears what you have to say. A professional emphasised the importance of verifying that the consumer understands what the doctor said. And from an adult child, their parent was too frail to sit in a doctor's surgery and to travel to the city for specialist appointments. So those things, I think, could make a difference. I've also got some learnings about methods, but that can probably be something you can refer back to. Multiple methods are important, and the challenge remains engaging with withdrawn consumers who are difficult to hear from, but some of these ways were quite effective to learn some things. And if you would like to know more, the report is on the Gippsland PHN website, so feel free to go there if you'd like to read the full report. Thank you very much.
And we have time for a question. No questions. Okay, thank you, Maria.